Thank you, Dr. Roy.
I think
And we move on to the next one.
yes, we move to the next one.
Dr. Parthasarathi is here.
Dr. Parthasarathi.
Yes, ma'am.
Yes.
I am here. Can you hear me?
Yes, sir. Yes, sir.
Everybody, I am now presenting my invention. A squinted person has a stable personality. I have no financial interest to disclose. This is the published article on this subject. Von Muden exemplified how two siblings, a 8-year-old girl and her 6-year-old brother, both having same magnitude of hypermetropia, reacted differently when confronted with excessive accommodative effort to see clear. Due to difference in their personality trait, the girl exerted excessive accommodation and saw clear but squinted, and the boy instinctively relaxed accommodation to remain orthophoric but saw blurred. Von Muden further stressed importance of personality by commenting whether the visual system reacts with esotropia and clear vision versus orthophoria and blurred vision depends less on the degree of hypermetropia than on a child's personality. He also noted mutually opposite personality traits between these two groups of children as represented by the girl fastidious and exacting nature and boy easygoing and relaxed nature. However, he felt that their observational impression needs to be substantiated by an appropriate study. But Dr. Muden's contention remained unanswered for more than 3 decades until a study on this subject for the first time in the world was taken up by the presenter, who published an article in 2017. Jones defined neuroticism as vulnerability to neurosis, which implies low tolerance for stress, whether it be physical as in painful situation or psychological as in conflict or frustration situation. Therefore, as per Jones' definition, the boy and the girl in Von Muden's example had a painful and frustration situation of asthenopia and diplopia and confronted a psychological conflict situation whether to relax accommodation and see blur or exert accommodation and see clear. Hence, according to my hypothesis, the boy in the example had low tolerance for stress and thus had neurotic type of personality, and the girl had tolerance for stress and therefore had a stable personality trait. Therefore, the bottom line of development of concomitant squint is to choose a conflict situation between phoria and tropia, clear vision versus orthophoria and blurred vision. Hence, it is evident that the development of squint is a function of child's personality trait. There are ample evidence also that a child's personality trait is carried forward to his adult life. Therefore, the presence or absence of phoria or tropia in an adult may be indicative of his personality pattern. A myopic student population was selected as sample for the study. It can be safely presumed that these students in their childhood faced the psychological conflict situation as described above and ended up with either exophoria or nophoria according to their personality trait. In this study, personality was considered as a cause of phoria and not an effect of it. 58 myopic students were included in the study. The personality of the students were determined on 2 dimensions, neuroticism and extraversion, by Maudsley Personality Inventory for 48 questionnaire. And at the end of answering, each student was examined for presence of horizontal phoria at distance and near by means of prism bar cover test. Now the result, the Fisher exact test comparing 2 groups, phoria and no phoria, and 2 outcomes, n value less than 24 and n value more than 24, shows highly statistically significant p-value. However, the same test with E-scale shows no statistically significant p-value. From statistical analysis of the results obtained in the study, it is seen that 81.08% of those with phoria will have a chance of having stable personality pattern compared to 33.33 of orthophoric, which have such chance. This difference is highly statistically significant. Therefore, phorics will have a high tendency to have a stable personality and low tendency for neurotic personality. This was evolved by the study. Thank you.
Thank you so much, sir. I think that was a very useful observation to make. And anybody has any questions? Because with the statistical analysis also, and that too in myopes who were students and who were who knew about the possibly the pathology also, this was evaluated. Thank you so much, sir. I think we will move on to the next presentation.